Hello, greetings to everyone. Welcome to our discussion about personality disorders. Today, we will discuss the second category type or group, which is the cluster B. I hope you can stick till the end of the video. Thank you, and without further ado, let's begin. So, cluster B, also known as the wild type, it is called wild due to the emotional instability associated with each other. It consists of four characteristic traits, which is the borderline, antisocial, narcissistic, and histrionic personality traits. Though the borderline personality and antisocial personality have such complex and in-depth detail, which we can discuss more in our future video, we will focus on the most common underlying pattern among these four types of personality traits. The core factors that link all patients with cluster B personality disorder together is their sense that their emotion is unbalanced, with sadness, anger, dissatisfaction, irritability, and emptiness are the most common core symptoms. So the wild cluster. Because of this wild cluster is often misdiagnosed as a mood disorder. But unlike mood disorders that is defined by mood state, cluster B personality is more on the feelings of negative emotions. If you can remember the ocean trait, it is characterized by high neuroticism. In addition, these people have low self-esteem and unstable sense of identity and an extreme insensitive or sensitivity to reaction and criticism. They are very sensitive and will get wounded with slight indignities. So, in short, the combination of poor self image and emotional instability is at the core of all cluster B personality disorder. So, remembering this will give you a clear picture of the four. However, there are also pretty significant differences among the four, which we will discuss as we go along with this lecture video. So this next slide or picture is to present to you how these four types differ in severity and gender. On the left side is primarily seen in women, while on the right side is primarily seen in men. This mostly has to do with culture bound and difference with how men and women are able to express themselves in the society. As you can see here, the upper part is known to be the most extreme and disabling, namely the borderline and antisocial. These people find themselves isolated, hospitalized, incarcerated, and unemployed, while the other personality traits in the lower portion, which is histrionic and narcissistic personality, are less impairing and can be able to support themselves and can maintain social relationship. Next, we will discuss each one of these in detail. So, borderline personality disorder or BPD is a syndrome of chronic instability in multiple areas of life. It is often mistaken as bipolar disorder because of the mood swing in emotions and behavior. But we will discuss its common characteristic and why it is different from a mood disorder. So here are the clinical features of BPD, and it is as follows: argumentative or sometimes depressed, intense and unstable emotions or mood. They also feel both dependent and hostile. They often view people as either nurturing type or hateful and sadistic type. So this characteristic is also called as splitting. It is the tendency to see the world as black and white, where the person either believe in extreme positive or good and extreme negative or bad. There is often no in between. Frequently shifts attachment from one person or group to another. The absence of sustaining and caring relationships, dependent on those who are close and anger towards them when get frustrated. They also have impulsive behavior such as self-injury, substance abuse, and risky sexual relationship, and also unpredictable behavior. So the most common treatment for this personality is the so-called dialectical behavioral therapy. So the patient is often stable and do not change over time. These people show high incidence of major depression. Behavior therapy to control impulses and anger outbursts and to decrease the sensitivity to criticism may be helpful. And individual psychotherapy and group therapy are also effective. So this is the only brief overview of borderline personality disorder, and we will discuss this in a separate video in the future. I hope you can watch it for your future reference. So next we have antisocial. It is also known as sociopath or psychopath and is characterized by long-lasting antisocial behavior that violates social norms and others' rights and thus engages in criminal activities. So this personality cannot be used to diagnose children and must only be used for 18 years old and above because it needs certain development and milestone to meet the criteria. So the clinical features of these traits are as follows. So they often violate social norms, exploiting of others by violating their rights, lack of empathy or lack of concern for others, irresponsible at school and work, irritable and aggressive behavior, impulsive behavior, lack of remorse or guilt, poor frustration tolerance, failure to learn from experience, and inability to maintain a stable personal and sexual relationship. Also, in the beginning of childhood itself, there will be history of lying, stealing, running away from home, fights, and substance abuse. So these are the features of conduct disorder. Like BPD, antisocial is a severe form of cluster B. That is why it is marked with impairity and social relationship problems. But unlike BPD, however, antisocial disorder is commonly diagnosed with men than women, as irritable and aggression is seen as most cultural acceptable for men compared to the attention seeking and self-harm seen in borderline. So, the treatment of this disorder, it runs in unremitting course, but studies show that disorder diminishes with age. Hospitalization for psychotherapy will be helpful too. Self-help groups and therapeutic community settings with environmental manipulation will be more useful. However, drug therapy must be done with special attention to prevent abuse. And just like BPD, more of this disorder will be discussed in the upcoming videos. So please stay tuned for more video about this. Next is the narcissistic personality disorder. It is characterized by pervasive pattern of grandiosity, desire for admiration, lack of empathy, and inflated sense of self-importance. This is commonly seen from early adulthood. So these people believe that they are superior to those people around them. They expect special treatment and admiration from their looks and status. This disorder is commonly seen in men. So the clinical features is as follows: grandiosity, feeling of self-importance, self-centered, sense of self-worth, and expect special attention or treatment. They also disregard and lack of acceptance of others, lack of empathy, and arrogant in nature. Sensitive to criticism, make conflictual relationships that are superficial and exploits others. Ambitious for fame and daydreams about success and power. And then, manipulative behavior. However, in reality, people with these personality traits act this way as a defense mechanism to hide their sense of insecurities and fear of being unloved, as found in all across the cluster B personality disorders. So the management. So next we will discuss the management. Though this disorder is less impairing and less severe than the other two that we have discussed, it is chronic and difficult to treat. However, psychotherapy with psychoanalytic approach is known to be helpful. These people are more prone to develop depression and anxiety disorders. That is why antidepressants can be included and can be useful. These people can be highly successful in their career, and their impulse control is much better than BPD and antisocial personality. The most common affected aspect of their life is when it comes to relationship, because building and maintaining a successful relationship is difficult and can be challenging. So a treatment or therapy that addresses their relationship skill will help the most to improve their condition. Lastly, the histrionic personality. It is described to be a long-lasting attention-seeking and self-dramatizing behavior. They maintain self-centered approach in personal relationship. These personality traits crave for the approval of others and is self-centered to the point of being seductive, wearing a flashy dress, and sensitive emotions. They also use theatrical speech and may show themselves like a spoiled Karen-like behavior. They often feel like every relationship, like a simple friendship, is intimate than they really are. These core symptoms of traits is rooted from the intense desire to be loved, which is related to all cluster B core traits, which is poor self-image and unstable sense of identity. If we are going to analyze this, this is like the equivalent of narcissistic personality trait but seen more in women because of cultural expectations and norms. The keyword in narcissist is being arrogant and bragging of one's worth, while histrionic, they are flirtatious and obnoxious in nature. So clinical features are as follows. attention and approval seeking behavior, dramatic behavior, exaggerated and emotional response, excessive sensitivity and disapproval to criticism, over concern with physical appearance, craving for novelty and excitement, seductive and will be the center of attention. They are flirtatious or provocative. Low frustration tolerance, self centered, lack of concern for others, highly fluctuating emotional states, and easily influenced by others and falsely believe that relationships are intimate. Since histrionic is considered the less impairing and severe form of among cluster B personality traits, the management is quite easy compared to others. Though they have manipulative and obnoxious behavior, it lacks the anger and destructiveness personality seen in other cluster B personality traits. So those are the cluster B personality disorders. I hope you've learned something today and see you again on our next video. We will discuss the last cluster type of this disorder. See you again and thank you again.